All right, good night, everyone. Welcome to Talk the Ting with yours truly, Dwayne, and my partner there, Hadley. So tonight we'll be having a very serious discussion where we will be talking about mental health and its impact on us in the Black community, both in the United States, where a lot of us live, and back home in Dominica and in the Caribbean as well. Um, a few housekeeping items. So we might be opening the floor for people to ask questions. So if you do have any questions that you didn't send earlier on, you guys could send that over to us in the live, in the chat. We also will have the possibility that this episode, due to the content, possibly could go a little longer than an hour, but we are going to try to value your time, so we won't be trying to make it any longer than we actually have to. But if the discussion is actually growing, we definitely will not try to cut it off. So if you have any questions, you guys could send them over in the live, and we will look at those questions a little bit later down in the interview. So tonight we have with us a young lady from Dominica, currently living in the United States, who's qualified in the field of mental health. And we thought that was important, that we bring somebody who actually knows what they're talking about and who actually works in the field, and so we could have, a good discussion on mental health. So with that being said, we'd like to welcome Miss Fiona Francis to the show.
Hello. Hi.
Hey Fiona, how are you doing?
I am good. How are you?
Doing good. So
how are you doing, Miss Francis?
I am fine. How are you, Hadley?
I am great myself.
I'm good.
So Fiona, I mean, I've known you for a number of years now. I mean, we went to the same school, which is Granby Secondary School, not Pierre Charles, all right? That's to show you that
I know, right?
Little kids.
The real deal.
Right? Fiona is from the village of Fort Saint-Jean. If a lot of you guys don't know where that is on the south of the island.
I think everybody knows where it is by now.
I don't know about that, man.
The fish place.
Some people still saying they don't know where Granby is. I don't know going on.
Everybody know where Granby is.
And Fiona is, somebody who we've definitely been following, and we think that she definitely is qualified in the space of mental health. So we're gonna have a good little discussion tonight. But first of all, Fiona, I mean, just give us a little bit of background on yourself, and how do you get into the field that you're currently in right now?
Okay, so I am Fiona, and I am from Fort Saint-Jean. I was born and raised in Fort Saint-Jean, like not even in a hospital, in Fort Saint-Jean, born at my grandmother's house. And
Wow.
I was raised there until I was like 3 or 4, and then my mother married and we moved to Portsmouth. So I was born on the southern part of the island. Then I was raised in like my elementary years on the northern part of the island. So I went to primary school up until like 7th grade common entrance in Portsmouth. So I have people on both ends. I know a lot of people because I was raised on 2 parts of the island. And once I passed common entrance, I was sent back to Fort Saint-Jean to leave. And I went to high school. That's how I ended up high school in Grand Bay. So I did a lot of back and forth between Fort Saint-Jean and Grand Bay, Portsmouth. I went to high school. After high school, I worked at Courts Dominica Limited for like 4.5 years. A lot of people might know me there. Working at Courts, I did sales in the sales.
A little bit of
For some reason, your mic was just muted.
Just muted.
Did I go mute?
Yeah. Okay, you're back now.
You're back now.
I'm not able to hear you.
Sounding real low. Can you hear us now?
No, I can hear a little bit Let me.
Okay, hearing you better now.
Okay, I can hear you. What
All
happened?
right, good.
What was the last thing you heard me say?
You were talking about you were working at courts
Yes,
and
I worked
yeah.
at Courts for 4.5 years, and I worked there in sales. That's where my love for people kind of blossomed. Talking to people about stuff they were buying. I met the most beautiful people there. People who you would never know that you were trying to sell a fridge to somebody, and they end up trying to counsel them at the same time. And going back now, I realized that's what it was, and I formed a really tight relationship with my customers. After leaving Courts, I went on to Boston to study at Quincy College in Boston, Massachusetts. And I transferred schools from Boston to Louisiana, Grambling State University. And once I got to Grambling, I studied social work at Grambling. Let me backtrack. In Boston, when I originally attended university in Boston, I wanted to be a journalist there. But I had a mentor at that time, and he told me, I don't think your accent will work with journalism. You haven't
Wow.
Really?
have a
Wow.
language barrier. And at that time, I didn't even know the meaning of language barrier. I mean, I knew it, but in depth, I didn't have a language barrier. I can
Right, right,
communicate very well. I just have an accent, which is, I speak English. So
right.
once he told me that, I was like so disappointed because I always wanted to be a journalist. Like ever since I could spell the word, I remember that's what I wanted to be. I changed my mind and I came to Grambling and just chose something off the curriculum. I kid you not, I did not have any intentions of studying social work. I just watched the curriculum and I'm going to do this. And I got into social work. I loved it. After that, I just went on to get my master's. 3 or 4 years later, I got licensed, and now I'm a licensed clinical therapist in Shreveport, Louisiana.
Nice.
Yeah.
So basically, you kind of answered a few questions, and you just said that you just picked something off of the curriculum, but it seems like this was always what you had to do
Right. It
from you
resonated
saying
with me for some reason.
right
Yeah.
from you forming those relationships with your customers at courts, having that
Mhm.
customer relationship. So now that you're in it and you're licensed, I mean, when you're licensed, you get that's almost the highest point.
Mhm.
What does mental health, this thing that you deal with almost every day, what does it mean to you?
Mental health means to me when people are not okay. Basically, people are like, what do you mean when you say people are not okay? The everyday norms, people are not able to cope with their everyday norms. The things that you and I can go through, somebody is having a difficult time just not able to do it. And sometimes we go through life and we get depressed and we use the word loosely, and we're like, oh, I'm depressed, not knowing that the meaning of the word is so much deeper than what we're saying. And people are like, oh, I have a problem, I'm traumatized. And trauma to somebody means like somebody at the airport missed a flight. They're like, I'm traumatized because I missed my flight and I have somewhere to go. That is so, I don't like when people do that, because somebody who's really traumatized or depressed is really going through something that is keeping them up all night, something that's preventing them from eating, something that's preventing them from breathing and having like a real life panic attack, such as like an accident or fear of flying, and they get on a plane and they can't breathe and they have like tightness in their chest and their palms are sweaty, and all of a sudden they just feel like they're dying. But we use terms very loosely because that's how we were raised to. And a lot of people feel like depression is easy to get over. It's not, especially major depression, clinical depression, where people have to actually seek therapy and seek medication. That is very difficult to work through.
Oh, that's a lot. That's a lot to take in right
Yeah.
there.
Yeah. I mean, one of the things that you said, which kind of resonated with me, is depression, right? So I remember when I first moved to the US, I used to always say, man, oh, there's bunch of people in depression and thing there. But I quickly realized that, because the more you hear about suicide and people, let's say some people that you maybe deal with on a daily basis constantly in a funk, or they they think about a lot. Their mind doesn't rest and those kind of things. And how do you think that depression, how could we deal with depression in terms of,
Depression,
yeah.
the way that we deal with first of all, we all get depressed. That's the thing. So it's okay to admit that you are depressed. What is not okay is to stay depressed and remain in that funk. You know what I mean? We all get angry, we all get sad, we all get emotional because we are living, breathing human beings. If we don't get those things, we're not alive. You know what I mean? The same way that you can get happy and excited is the same way that you can get angry. And how you deal with that is by applying coping skills to your daily life. Exercising, healthy eating, talking to people that you trust, not everybody, because that's the thing. People might talk to the wrong person and then it might go somewhere else. And they're like, oh, all of a sudden it's a rumor. And people have committed suicide. Kids that being bullied or experience that they talk to the wrong person and they end up, children that are homosexuals. So they come out of the closet, they talk to the wrong person and they end up killing themselves. So stuff like coping skills, like relaxation, breathing, eating right, exercising, practicing meditation, mindfulness, like being mindful of what you're doing, where you're spending your time, who you spend your time with, particularly spending your time with, because toxic people can take away a lot from you. And being intentional of who you spend your time with can, lead to, less depression or less severe depression.
Okay. So before we get into people and their dealing with the issue of mental health, we want to stick on you for a little bit. And I'm just curious as to you having to deal with so many people with so many different troubles. People having to confide in you. Is there any challenge? Are there any challenges that you face as an individual? Like, is it possible to kind of feed off that negative energy from some of the patients that you get? And how do you deal with that?
Definitely, Hadley. There are days when I stop and I just cry. Like it has gotten a lot better because I've been doing this for 9 years now. Well, 9 years as a licensed person, 12 years since I've graduated with my first degree. But there are days when I just shut my door and I cry because I have a thought where she's going to be 4. And I have to come home and deal with that. I have my own family. I have my own issues. I have my family back home that I think of and all that stuff too, and their problems. And everybody that comes in my door is not just one person. That's one person with a family of people,
everything, right,
or a multitude of people bringing in on them. So now you're talking to me, but it's because of your girlfriend, it's because of your dad, it's because you've been molested. And now I have to think of all these people and why they may have done what they did. And what I do is I have a therapist myself. I talk to her. That's because every therapist needs a therapist. There's no one person that can take all that load and just come home and act like I need to talk to somebody. And I have very good people in my life that I talk to, and I love to go to carnival. If there's a carnival, I'm there. So that is my coping skill.
That was gonna be one of my questions, right? Like, how does the therapist deal with their own issues, right? And in terms of like, if you make the correlation to like the police, right, with all what's going on, like who's policing the police, right? Kind of thing.
Right.
So,
and they need that. That's why there's so many disconnect. Because if I don't talk to somebody, I cannot take all of that on me. I can't tell the therapist what my clients have told me because of ethics and being confidential. So I have to make sure that I talk about what's going on, what I feel, not what that was dumped on me. And I have to be very strategic in how I do that because I can get in trouble. It's easy for somebody to walk through my door and say, well, I was abused and oh, I don't have any money. I've lost my job during COVID. But I can't go to somebody and say, well, I have 3 clients that lost their job and I can't do that.
Right.
Right now I'm breaking ethical codes.
Right. So question. So a client comes into you, right? And they because I I always think of mental, right? The mental is something that we cannot see, right? We look at people and we think they're okay, and they have a lot of things going on in their head. So, if you go to let's say a heart doctor, they go and they do all the tests, and they check what's wrong with
Mm-hmm.
you and they give you medication. How does a mental therapist go about, from start to finish, let's say, treating a patient, right? And
Okay.
how, in your opinion, what do you think when somebody comes to you? Do you instantly think that you kind of figure out, well, whether or not this therapy is going to work for this person, or is it not?
Okay. So most times I get when people come to me, they're referred to me from either the hospital or the psych ward or the school for kids. They've been displaying a certain behavior. So first of all, that has to be targeted, like the behavior that's been displayed. So somebody just can't say, okay, let me just send Dwayne in because I think Dwayne needs help. I need to know what are the behaviors that Dwayne is displaying or are displaying for us to come to that conclusion that he needs some type of help, whether it's paranoia, whether you're talking psychosis or hallucinations, you're telling me that you have visual sightings of things, or you're just being hopeless. For depression, there are signs. People are hopeless. They don't have any pleasure in activities that they like. For example, if all of a sudden I turn around and I was like, well, I don't like carnival anymore. I just gonna be a homebody. Unless if I've decided with intention that I've changed the route of my life and that's not what I want anymore, and I've explained to people and they understand. But if I just quit something like I love really cold turkey, that is a sign that I may need help. So that's, first of all, that's what needs to be put in place, that people need to have a behavior that is being displayed so they can be referred. And once that behavior is observed, they're sent to people like me, licensed clinicians, and we have an assessment done. An assessment is usually about an hour, and I talk everything: your history, your family, your psychosocial status, your economy, like your finance, everything. Trauma, past trauma, if you've been in DCFS as a child, any medical history that may have, because some of the things are genetic and they are in your DNA, like schizophrenia and stuff like that. People do inherit it from their family. Once I get to that conclusion, there's a book that guides me. It's called the DSM. It's a diagnostic manual, and I go by that book. Every clinician needs one. It's like our Bible, because it has like hundreds of disorders in there, and they have to update it every year to make sure. And it has symptoms, it has criterias, so we can go back. It's almost like a cheat sheet that we use,
A
that we go
reference,
back.
right?
So we go back to it to make sure that the person has you need at least 5 symptoms, because you can't, some people do display like 2 things and we say, oh, they're depressed. And sometimes it's just they having an acute symptom. An acute symptom means just a short space of time, like probably somebody died and they're displaying that behavior, which is normal because they are grieving, and grief is a normal reaction to loss and whatever. So once I do that, I will diagnose the person based on the book and based on my knowledge. I've been doing it a long time, so I kind of know the book off my head. And so I'll do that, and then we'll submit the person to regular counseling sessions after that. So I'll ask the person, do you want a weekly session? Depending on the severity of the problem, because the criteria falls mild, moderate, severe, I will determine if they need like a 2 days a week session, just a 1 month session, and so forth.
So I'm gonna throw a little wrench in here for a second. What there's one thing that we have. There are people who kind of fight the whole idea of mental health, and every time somebody does something, oh, they have a mental problem. What do you say to these people who are always doubtful as to whether or not this person is really going through some mental issues? What do you say to these people?
The people that are like
the doubters.
The doubters about,
yeah.
Oh, well, we want to know why they feel like that, because you always want to know why people. Why do you feel like they don't have a mental problem? Why do you feel like that person is just mean and they don't, back home, they're like, they don't have nothing else to do. So why I've heard that. Why you think it's because the person really don't have nothing else to do? They're just walking on the street with no shoes. I grew up in a family. I can tell you there's mental illness in my family on my paternal side. I have like 3 uncles. Knowing now they are schizophrenic,
Right.
I know that now because I was educated, and when you're educated, you're empowered. And a lot of times, like he mad. He was overseas. He come back. He mad. That's
Yeah.
all I heard. And nobody took the time to talk to the people to find out what is going on. Like, why are you acting the way that you're acting? Because the behavior is not normal. Mental health is you're not okay.
Mhm.
You're not acting in the norm of what society has, put in the dictionary as the norm.
As a norm, right, right.
Right.
Okay.
So a couple of things that you mentioned earlier on, and I'm just thinking about it, right? So you mentioned the physical, right? The physical important. I guess what do you think, or how do you correlate the relationship between the physical health and mental health?
Oh, how you feel in your mind. When you look good, you feel good, basically. You see a lot of women get dressed, even during COVID. Like, I'll get up, I'll get dressed, I'll put makeup, even if I'm in my house doing session, because it makes me feel like I'm going to work and makes me feel better mentally. Your physical appearance has a lot to do with your mental health, because how you see yourself in the mirror then vibrates what happens in your mind. So, and a lot of people that are depressed too, it's because of their physical and medical issues. Like a lot of people, well, I have this bad back and I can't work. I can't provide for my family. I used to be an avid runner. I can't exercise anymore. So all of a sudden, they're depressed and they're angry and they're upset. It's because of that medical condition, right?
Yep. I mean, you think about, and one more thing you mentioned about, even in like back home, the attitude of, people mad and, write them off.
Mhm.
And, I'll tell you, like I have one of my cousins I grew up with, right? And his mother, had mental issues, I could say. And I don't know his father, but his father supposedly had the same. And not as bad as his mother, but to some degree. And me and this guy grew up together. Like I'm talking about, we learned to ride bicycle together. We used to do everything together. And now when I go home, Fiona, I see him, like I cannot look at him, because every time I literally look at him, and even now I talking about him, like I want to get emotional, because it
Yeah.
just hurts me so much. Like he literally just walking around Roseau, like, so I'm thinking, how do we deal with that, and how do we change the way that we think about that, in the Caribbean and Dominica for more specifically?
First of all, we need to take care of these people better, like institutionalize them, put them in a hospital that will help them, put them in a rehab center that's going to take care of them, have a setup for them. That I know in Jimmy they have one. I am not too familiar of how the operation goes there and how it's operated. But having I know there's like the psych ward that people go to, and I can't speak on the ins and outs of it, because I don't practice in Dominica. You know what I mean?
Right.
So I don't know what their policies are, but I know that having a plan in place, putting something specific in place, a number you can call, whether it's in every community, there's a police or there's a specific person that to go to when somebody's displaying those type of behaviors, that you can nip it in the bud early. Because you said you grew up with him. Over time, he didn't just start acting like that last year, right? It's
No.
over time the behavior came, and then it got worse. I'm not saying he's probably not going to the psych ward and they probably not medicated him. What I'm saying is having a plan in place, a long-term care plan from start to finish that will help them, not just medicate them, put them back on the street. Then they get the medication wears off, and sometimes they don't even take the medication because they don't have the control to take it. They're not going to take it if somebody is not in a position to say, hey, you need your meds today. Did you take your meds today? Showing those people that you care about them.
So I'm going to be somewhat of a villain for a little while.
Mm-hmm.
And you mentioned medication and institutionalizing people and whatnot. And it is alleged that in, I think, the country of St. Vincent, that your somewhat of your field was kind of used as a weapon to endanger a female. She was involved with, it is alleged that she was involved with a minister. She made couple allegations. They didn't, it was this, they said it wasn't true. And then it was all about that she was crazy. She is crazy for saying what she said. And then they took her into that institution that you just spoke about.
Mm-hmm.
And it is alleged that she is medicated. She was medicated, and now she's all over. She's out now on social media doing the craziest of things. Now, if you saw photos of that girl previously, you would never say that that's her. So that might be one of the reasons why certain people are staying away from even seeking help, because it can also be used as a weapon if the people doing the work don't do it right.
Right.
So for the people who are afraid simply because of situations like that, what do you say to them? And can you touch on medication, like actual medication that you give? Can you touch, if you prescribe, can you touch on that as well?
Well, for people who are not, well, scared or, wary of going into the psych ward or an institution that is psych related, I think you should have like a backup plan as in terms of a family. Because once you do an assessment, there's something called a crisis and the discharge plan that they have to do. So we kind of list your family members and the people that you're close to. So they keep very close tabs of what's going on with you. So if you're scared and you don't want to go, what is the other option besides not going, right? If you're acting like that, you're gonna be a property of the state pretty soon when you start going haywire. So that would be my plan, to have people that, like a backup plan, that can monitor what's going on with you. What was the second part of your question?
The second part was medication. Do you prescribe medication, and at what point?
No.
Okay,
So
you don't.
my psych doctor prescribes medication. I can diagnose the person and mention diagnosis, put the diagnosis in, diagnosis code, but I don't write prescription because I don't have an MD. I have a license, clinical social work license. Yeah.
So you can't even tell. So you just don't deal with physical medicine.
I am aware of the medications that are available. I have to know them. Even to get the license, you have to be aware of what deals with what medication. But you just can't write the script. But you know all about it. So what is your question that you wanted exactly to pin on medication?
No, I just wanted to know that. I thought you prescribed medication, so I wanted to find out at what point do you think that medication
needs to be
required, right?
Yeah, it's required, but you don't.
Okay.
So
yeah.
So I'm gonna make this a little personal, right? So listen, I'm a Black man living in America, and we all know what's going on right now. But I mean, my train of thought with therapy, right, is I like I said, when I first came here, you could not have gotten me to speak to anybody about anything, right? I my opinion was I speak to my friends or I speak to my mother. Everybody knows my mother, and that's it. Now I have a slightly different view on it. However, right, I'll admit I've gone to a couple of therapy sessions when I feel a certain way or whatever, and the challenge for me though is finding people who look like me, right? Who could maybe understand the things that I am talking about. Because honestly, for me to go sit and talk to somebody who looks completely different, who's from a whole different background, I personally don't feel like that benefits me. That's just my opinion, right? I could be wrong, but I honestly haven't put in the time to even know. Do you think that particular dynamic where, let's say Black people, Black men more specifically, will have this stigma of, oh, therapy doesn't work and all this stuff, and they don't want to do it, but then when they actually go, they're not really talking to somebody who could really relate to what they feel, You know,
Yeah,
what do you think about that? And, you know, how do you think we could address that issue within
I
the black
agree. We
community
just
and
need
black
more
men?
clinicians of color. I agree. 100%. I agree. Because we go for the same thing. We were kind of raised in the same households because we have the same morals and the same values because we
Mhm.
come from the same culture. So I agree. 100%. Not that you're bashing the other person. It's just that one person. I have a clientele of 96% African American, and the
Oh
rest
wow.
is Caucasian. And I do love my clients all the same. What I'm saying, the others, they vibrate with me better. The first thing that they look me up on psychology today, and they was like, I just felt like I can vibe with you. They'll tell me stuff like that. And I know it's because they see me as probably the person they would have talked to if they
Yeah.
could have find that person to talk to.
Outside of the official therapy, you know, like just somebody that you could relate
Yes,
to, you know. Yeah.
yes, right, right, right. So that Black man needs to speak to people they resonate with so they can express themselves better. And that's why we need more. The thing about that is we need more clinicians of color. And there's been a theme over this time, especially now in this time. On Facebook, I follow a lot of groups, people just encouraging people to join the field, especially now during this pandemic, you know. I also have people on the live encourage them if they're trying to find a field that they feel they can give back to, where it's very rewarding. You know, you get to help people, you get to help change people's lives, and people seek you. People look for
Mhm.
people like you. And I think everybody has that one purpose in life, and the purpose in life is to strive, not just strive and thrive, not just be
Mhm.
here.
Not to just exist.
Right, right, right.
Right.
And I feel like that um profession that I'm in is about that.
I mean, I think about one more point in terms of black men and black people on a whole, right? I think that's just my opinion, is that we need to, and I'm talking about now the authorities, especially black home. I don't want to get into politics and all of that, but these things I feel need to be things that are talked about in schools, right? Talked about, not and to me as early as primary school, because like we all went to primary school in Dominica. Like we know for sure that there were certain people, like even in primary school you could see like their head just wasn't there. You know what I'm saying? You could see that.
But when why do
And
you
some
think
of
the
these,
head wasn't? Why do
Why
you
we
think the head
why we used to
wasn't
say
there?
me say foo?
me say fool,
But
yes.
That
why
what
do
we
you
used
think
to
the
say.
head wasn't there doing? Question to you. Why do you think the head just was like how that's the behavior I was
What?
talking about that you
Mm-hmm.
noticed. And you see
Mm-hmm.
how you said we need it in school and nobody was paying them attention?
Well,
You
the
knew
thing
the
is,
head
right?
wasn't there even as a child. Don't you think a teacher or somebody else in the community that was older than you knew?
Mm-hmm. But the thing is, right? I mean, for people who don't know, my mother's a teacher. My mother's a teacher for years, and me and my mother always talk about those kind of things, right? And my mother always used to tell me little things like just knowing the background, and like you say, like there's always a reason why people do what they do, right? And even today, I still operate in that way, right? So, for example, you have a young kid who's coming to school, and yeah, they rebellious, they this, they that, and everybody say, well, the child malka say, and the child this and the child that. But that child may be dealing with some crazy stuff at home that
Crucial.
that you and I might not even be going through, and we might not even be thinking that, well, a child is actually going through it, and I know that there are times that kids will come up and say to an adult, hey, this is what's happening to me, and people will dismiss it, right? People will dismiss it. So after a while of you constantly bringing it up and trying to talk to people and seek attention, and you're not getting it, then what do? You lash out, right? Eventually, right? In
Right,
some kind,
right,
in some
because
kind of
it's
way.
right, because like I was saying earlier, it's all emotions. You have anger, you have happiness, you have sadness, you know, you have excitement. All those are emotions. So if you cannot express the ones that you're feeling appropriately, the easiest, like they say, negativity is easier than positivity. So obviously, the first thing that you're going to do is lash out and be angry. And you talked about depression in Black men, or Black men, but it starts with depression in Black boys. And that's where it goes through. Because as a Black boy growing up, you're at your house, you're at home, somebody in your family dies. You know, they dress you up and send you to school, right?
Yeah.
Somebody died.
Yep.
You still go to school the next day. You still go to school that entire
like
week.
nothing happened. Yep.
Leave pour aller l'école.
Right, right. Nobody pulls the child aside and say, how are you feeling? Are you okay? Did you, do you know what happened? Do you understand, the transition from life? Nobody says anything like that. Put your clothes and go to school. And you're supposed to perform in school very well too.
Right.
And compete with other students who are not perfect, but who have a stable home and no major trauma in their life.
Okay, that's true. So let's move on to one of the questions from one of our viewers. We want to make sure that you guys are part of this conversation. And please like, please share, leave your comments. We'll try to get through your questions. As would say, share the live.
Share the life.
Share it. So here's a question, and it goes like that. What are the risks of misdiagnosing somebody and the impact that it has on that person? That's from one of our viewers.
Yeah, that's a
great question, by the way.
That's a very good question, because it does happen in our world. The risk of misdiagnosing somebody is person might be put on medication, and now they're taking the wrong medication which might have major side effects, and the person might end up with a dual diagnosis at the end of the day due to that medication. The risk for you as a clinician, you can lose your entire license.
Would that be something that you could actually be like taken to court for, or?
You can be taken to court, but you'd have to be subpoenaed. No, I mean, a lawyer can take you to court, but they have to subpoena you to like actually be in court and stuff. So the lawyer can talk.
Quick question, in terms of court, I don't bring that up, but I know like the HIPAA laws, right? Like you cannot give somebody's, health information and all that stuff, right? If you have to go to court, do you have to is that still covered under HIPAA? At that point, do you have to?
No, you need malpractice insurance. Like I have $3 million in malpractice insurance.
Whoa!
Wow!
In case somebody tried to step,
right.
$3 million. But I'm not saying that the person doesn't have a right to step. If the person feel like I didn't do my job right, they have all the right to challenge me. But I'm saying I have to protect myself also. You know what I mean?
We can plan something out and split the money then.
Wait, Papa.
Wait, you mess it up. You already don't go and say it on the live.
That's because we're not going to do it.
I have another question from one of the viewers. So, since you started, as a therapist, have you seen more acceptance, within the Black community, towards mental health and treatment for mental health problems?
More acceptance in certain areas. With kids, it's getting there more. It's getting better. Sorry. With women, it's definitely better because women are more open. Black women are more open. Black men is where the challenge lies. It's difficult because Black men are taught to be tough and resilient. You're like 10 years old and you're registered in basketball, football, all those things, you have to be resilient. And you can't go crying on the court. You can't go crying when they knock you and they tackle you down. You can do that in the football field. And then you carry that same mentality into your life. And then somebody dies in your life. Somebody gets shot. If you're in America, you're in that hip hop culture. Somebody gets shot and you go get a rest in peace tattoo and you think that's going to help you. No, you need to cry. You need to sit down and say that you're grieving and you're hurting and you need to talk to somebody. And that's where the problem lies with the Black men. It's getting better with the kids because a lot of people are open because a lot of children are being diagnosed with ADHD nowadays back home. A lot of people don't believe in it because they're like, I'm trying to struggle some. When I was growing up too, that's reality. That we didn't know about that. you know, when we were in
Mhm.
primary school and stuff like that. But now all 6, 7-year-olds know what ADHD is and what medication is good for that and that kind of stuff, because people are more open to it. Sometimes, me personally, I do not like to always give kids medicine.
Mhm.
I feel like the behavior needs to be changed at home most times. You know, the parents need to put more effort into changing the
Mhm.
behavior, changing the.
Would that be something that you would talk to the parents about though?
Oh, definitely. I would not. I create a treatment plan for kids and parents, because a
Mm.
6-year-old cannot rule
Cannot.
themselves. You
Right.
know, the mother has to be involved, and the mother has to implement those things for the kids to go through that thing and thrive. Also, too, there's that stigma of because of the culture, the United States culture. Um, People think that, you know, they get. I don't know if you guys have heard of that. They get a check for being ill. They
Yeah.
get
Yeah.
some type of supplementary income. So
Mhm.
sometimes people do misuse the system, and you have to
Right.
be very careful. So you can go ahead and people will like, well, my kid has a problem, my kid has a problem. And you as the therapist have to be like on game with, no, that kid has a
No.
behavior that needs to be changed, that can be
Right.
changed. Not that I'm saying some kids, are not autistic and that kind of stuff, but that
I
is.
mean,
So
one. Hadley, go ahead, Hadley. Go ahead.
let me say this here. So we want to make sure that we cater to every single one of our viewers, and
Mhm.
this question popped up, and I think it's very important because the military people are taught to be tough. You know, we are the
Mhm.
and all that. And somebody asked if you have any advice for military folks who may eventually deal with PTSD or actually are dealing with it right now, because these people are taught to be tough, but we know what they go through. So for the
Right.
military people on here right now, can you give them some
So
advice?
most military people will, if they've been away in combat and stuff, experience some type of PTSD because of what they've seen, what they've experienced, what they've witnessed, firsthand, and they come back to the States or whatever country you're in the military, most times is the United States, to just, go back into normal everyday life, and you're just society, and you have to supposed to be productive and get a normal job, and there's something called flashback that they have. So PTSD is post-traumatic stress disorder. So it is stress and trauma that's happened after the fact. And you have flashbacks, nightmares, you have imagery of what has happened to you. It's almost like you've had an accident. So I'm not sure if any of you have been in a vehicular accident. And every time you pass by that spot, you get that same
Yep.
feeling
Yep.
all over your body.
Yep.
Not just
Yep.
think about it, but you felt like your hand almost went weak because you might have broken your hand, or your head, you felt when your head was knocked against the windshield, you feel the exact same pain. And that's the body's, the mind response to how you feel. And that's what military people go through every day. Imagine that, passing in that same spot every day with that feeling every day. And the way we deal with that is cognitive reconstructing. So we reconstruct your mind and the way that you think every time that you have that thing, to tell yourself, no, that is not my reality right now. I'm in a better space. I'm thriving now.
Mhm.
I'm better now. So it's like constant reminder that you're doing better than what you're not in the same position. So you just have to reconstruct your mind. And there's a
Yeah. I
new thing
mean.
on the
Mhm.
market called EDMR. It's eye sense, something with your eye, like an exposure therapy. So they bring you back to the same spot or something exactly like that, and you're exposed to the same. So it's called gradual exposure, basically, and they expose you to the same thing over and over again until you get really comfortable with it. Or probably like you'll watch a movie or like a war movie, and like the
Mhm.
first time you might cringe because it reminds you of yourself, and the second time, and then you do the third time and the fourth time, and by the fifth time, like, okay,
You're
it's
like,
like you're scared of
yeah.
heights. Like you're
Right.
scared of
Right.
heights, and the more you go, then all of a sudden you're on a fourth floor and like, okay, I'm fine.
Yeah, I mean, it's PTSD is something that is, again, I've never been in military, but trust me, I know, and it's not just military people who have to actually PTSD, right?
No, rape victims
So
have PTSD a lot too. People who's been raped and kids who've been abused at home.
Hmm.
Mm-hmm.
You know, if you've had a kid who's been abused from the time they were 5 to like 10, 12 over every night constantly, that is cause for PTSD. And there's acute PTSD. It's called brief PTSD and long term. The brief one is like somebody dies or something really
Mm-hmm.
quick happened where you can get therapy for it and it can be over like in a month or two. But the real one is the chronic one that just keeps replaying over and over.
I mean, I have a 1-year-old son, and I remember growing up, right? Everybody always say, you know, oh, that child troublesome, that child troublesome, that child troublesome. And the other day, I was here, and my neighbor, who's actually a therapist as well, she has her son is about 18 months. So we were talking, and then and actually she was talking to my wife, and she says, he's just curious. She said he's curious. And so then my wife came back and she said, listen, we have to stop telling my son that he's troublesome. He's not troublesome. He's doing what kids do, right? They want to learn,
Right,
right? So
right.
they're curious, right? And I thought about that for many days. And I said, all of these little things, I think, kind of contribute to our, I guess, some kind of trauma, right? That when we're growing up is like, oh, you can't sit down, you can't do this, you can't do that. And then the other thing is, especially back home, the mental pressure, I think, and this is going to be a question, but the mental pressure of growing up with the expectation, right, that you're supposed to do a certain thing, or you're supposed to carry yourself a certain way, or you're supposed to do this and supposed to do that. How do you think that affects um young adults, especially those who are not, let's say, outspoken, who could, say, well, you know what, I'm gonna do what I want to do. There's a lot of people in their
Mm-hmm.
30s now and their 40s still kind of following their parents' path for their life, and not, and that's another, I guess, in my opinion, another kind of trauma, right?
Right, right. Well, it's not trauma because that is something that was your norm. That was your value system growing up, or your parents.
Mm-hmm.
So people that are like introverts, they might not be able to talk about it. And what happens is you condition and you label the child to be like that, like what the therapists say, that child is just curious. Because if you keep calling the child troublesome, then you know what's gonna happen? At 4
Yeah.
years old, he's gonna say, "I troublesome. My daddy said I troublesome,"
Yeah.
because
Yep.
you've labeled him that way. So
Yeah.
once you start putting labels on your kids, and that can be positive and negative. So we grew up in a society where we're supposed to be doctors, lawyers, something. Go to school and be something. And
Mm-hmm.
sometimes that's not the plan you have for your life at all, and that can cause you a lot of stress and depression because you do not want to disappoint somebody that has taken care of you for so long, but you're disappointing yourself. Now, who is more important in both scenarios, your life or your mother's life? Not that you don't love your mother, but
Mm-hmm.
if you had two, if those were your only option. Sometimes,
I mean,
some people might say my mother because I love my
yeah.
mother that much.
Yeah.
But are you completely happy with yourself with that one life you have and you don't have a second take? If
Exactly.
you died today, would you die happy? Because the
Mm-hmm.
only purpose in life is to live and thrive and survive and you know
Mm-hmm.
not just exist. You want that for yourself. So how about you take a different path and talk to your mother? We were not taught to talk to our parents, because if we talk to them, we're being rude.
Yep.
Talking
Yep.
to I wasn't raised in a home where I could, hey, let's sit down and no, if you talk back, you're being rude. I mean,
Yeah.
no, we can talk, but
So I'm gonna get a little personal for a second. So I was in a situation where I I convinced myself that I needed a therapist. I was going
Mhm,
for a phase in my life where I was job seeking, couldn't find a job. I had moved to a different state, and I was somewhat dependent on my partner. And
mhm,
it bothered me that as a man, as a male, always being able to do stuff for myself, I got
mhm,
myself in a position where I had to wait on somebody else, and I hated that,
mhm,
you know. And I went to my doctor, and I told him that I needed to speak to somebody, and then I started seeing a therapist. But I think where I'm getting is, I think I also did one thing wrong where, and you mentioned it, where if you're talking to somebody, we have to remember that they have a brother, they have a mother, and to a certain extent, they need to know what's going on. I saw a therapist for like 2 or 3 months with only me knowing what I was doing. Every day, I would go to the therapist, I would talk to the therapist, I was getting help, but nobody close to me knew what was going on. And can you, like, is that dangerous?
It's not dangerous, but it doesn't help.
Okay.
It doesn't help. It makes it difficult for you to get better, because now it's twofold. Now you feel like you're hiding something.
Yeah.
So you feel like you're keeping a secret from your partner, because if anything happens and you have your session and you'd have to make an excuse around why you can't be there at that time. And but kudos to you for knowing and taking that step, though. So the first thing is knowing that you needed help, and I congratulate you and commend you for doing that. You know, getting the help that you need and seeking the help that you need. The second step was talking to if you feel comfortable with your partner, you have to feel comfortable with her enough to know that, you know, the way I feel, that's not how I want and what I want for our life. You know, I want to be the man who provides for her. I want to be the man who do this, that. I don't want to, I was not like that. That was never the basis of our relationship. So why not talk to her about it? Don't you think she'd be so happy that you're talking to somebody and you want to make her happy? Because that was the ultimate goal of going to therapy.
I think it was that whole male thing,
The
trying to be
attached to it. You
tough,
want to be
and
tough and bold,
yeah,
and
yeah, you don't want your woman to know that you weak. You don't want anybody to see you like that.
If you have a very open-minded partner and you will decide that, there's no way she's gonna think that you're weak if you go to therapy. There's no way. If therapy is not the way people think about therapy, it's like a weakness. It's actually a strength. Knowing that you have a problem or an issue, you're not the problem. You Hadley or you guys are not the problem. The thing that you're going through is the issue, the job loss, the financial situation, the money management thing. That is the issue. Take that away from you. Your problem does not define who you are. So you have to think of it like that. If you have a headache or if you feel like you have a pain in the back of your ear, wouldn't you go to a doctor?
You go to a doctor, right?
Yeah.
Won't you tell your wife, hey, I think something hurting me, I'm going to the doctor. So why is this the same?
Again, is I think it's just that word, stigma. The stigma, like and that's what it was for me. It was me really not wanting anybody else to know what was going through my head.
Pride and stigma attached to it. You know, you don't want to look weak. But platforms like that and people listening, we'll have to let them know that it's okay not to be okay, and you have to get help.
I kind of felt like a guy going to the police station to make a police report on domestic violence. Like everybody's gonna laugh, like, watch your woman beating you. Like,
but then there's nothing wrong with that either.
There isn't, but it's just a thing that we have around, especially our Caribbean, our Black men, that we cannot be soft and we cannot be sensitive.
I get it. I get it. You have to you have to be strong.
So I mean, in that same vein, right? I don't think we could discount the I guess the elephant in the room of finance, right? And the cost of actually doing therapy, let's say the length of time, you know, because I mean, as we know, you know, the money situation, especially in the Black community, is not as good as it is for other races. So how do you think, I mean, for example, if I have to go to therapy and I have to pay $30 a session and I have to go, you know, for my copay, let's say, and that's if I have insurance, by the way. If I don't have insurance, I don't know how.
What session you getting for $30?
I don't know how much it costs, right? Exactly. So that is something that I think, I mean, if you could give me your opinion on that, but I think that also affects the Black community as well, because can we even afford to seek the help that we actually need, right? You know, what do you think about that?
that is why I present a sliding fee scale in my therapy practice. In my private practice, I present a sliding fee scale. So based on your income, I can see you and give you a price that best fits you. We will probably have a limited, acute brief sessions. I won't, because I have to get paid for my time.
Right.
With therapy, it's all about time and my resources, because I would probably have to refer you places and give you homework and all of that stuff. So all those things. Also too, in the Black community, I help people sign up for insurance for like Obamacare, Medicaid, Medicare, because I accept all of those things. And most of the therapists I know, they do. Most of the Blue Cross Blue Shield, Signal, the major health insurance companies will pay for behavioral health and therapy sessions.
Okay.
So if you can't make it, and some people prefer to be private, like Hadley was saying, it's gone to the point where some people will pay out of their pocket because they don't want their partner seeing it on the insurance or anything to do with that,
Well, I have one other question from a viewer. Can you ever heal from depression, or is it that once you're depressed, are you depressed for the rest of your life?
No, you can get over depression. You can choose to get over depression. Depression is just a phase in your life. It is not there. It's not there to cripple you. And once you get better, you get so much stronger that when the next thing hits you, you remember what it took to get over that last thing, that you double up on your strengths. So you kind of empower your own self. You can get over depression, but it's a thinking mentality. You have to change your thinking. Your cognition has to change. Like you have to want to get up. You have to want to motivate yourself. Like nobody can get you out of depression. Like I don't even have a magic wand to say, okay, it's over.
Yeah, not depressed.
I can guide you. I can tell you every morning I need you to get up at 6 o'clock and meditate and be mindful, take a bath, because some people have not taken a bath in 5 days, and that alone will help them feel better.
5 days.
That sound like a goop, well, boy.
But all that is depression, and we were just making light of the thing.
Wow, 5 days though.
One other thing though, I don't want to forget is, I know we spoke a lot about depression, but what is your opinion on anxiety and how should people deal with anxiety? Because there's a lot of different reasons people get anxiety, right?
Depression and anxiety sometimes go hand in hand. Anxiety is just excessive worry about things that you cannot even control. You just excessive worry. Anything that you think about, you ponder on it for too long. And like I said, it's all coping skill. You and I will think about the same thing and you're like, oh, okay, next plan B. But me, I will be stuck on plan A and it will just kill me, be detrimental to my health, to my thinking. I stay up at night. I think about that thing because I'm anxious. It makes my heart race. It keeps me up. I can't sleep. I can't close my eyes because I'm thinking of that one thing.
So I'm going to ask another question from one of our viewers who is actually, he works in the public school system. And I'm going to add on a little bit to that. And he wanted to know that what is your advice on people in the public school system, but also people in the policing profession? Because I think as students, when going to school, we think that our teachers know everything. We think that our teachers can deal with every problem. And we also think that the cops can deal with every social problem. So what do you think can be put in place, and what advice can you give when there's nothing in place to deal with these types of situations, both in education and also like policing and stuff like that?
To put people like me in positions where they work, like place somebody like me in a police station, place a social worker or therapist in the school. Well, they do have school counselors, they have people like that there. So because the teachers have so much to deal with, the teachers are the first persons or the first people that can usually notice something is happening with the kid. But you have 36 other kids in your class. You can't stop and just concentrate on that one kid all the time. That's why you need somebody that is licensed, qualified to talk to that kid. And the same thing with the police station. The police needs to be educated. They need to be empowered to know the difference between, because even in the States, some guy was killed because the police didn't realize he had a mental health disorder. He was shot.
Right.
But if the police was educated on that, and they had people, doing continuing education with them and stuff like that, holding classes, courses, seminars on those things to educate them, and also have somebody in place that they can revert those people or refer those people back to, because the police can't all do it by themselves.
True. And that being said, I just got you a client.
Yeah.
Oh. Okay.
Quite a few people are asking,
People have
are you
been-
taking patients?
Sure.
So
we'd have to do telehealth because of COVID. We don't see.
right. I was,
Right,
and I was
right.
that thought just came to mind. Like, how are you dealing with the whole idea of not being able to physically meet your patients? Because I think that's something that's important. Sitting in that
No.
room with those nice little LED lamps,
Coaches and stuff.
just oozing, and you talk. And how are you dealing with it? And how do you think your clients are dealing with it? Because they are in their same space. They don't come to that nice room where they have calm music. So how challenging is it right now?
Very challenging at first. Back in March, that's when I stopped the face-to-face. March 14th, I remember. Let me tell you, very challenging. At first, I could not understand, because some clients live with 6 and 7 people. I have so right now we're having session, and I see somebody walking the back of me naked, just like that.
What?
Yes.
Wow.
Because some of the people I deal with are very mentally ill, and I sometimes most time attract likes. So the person that they're with might be suffering from something too. You know what I mean? Or they just live in an environment that does not care, or they don't care about they're on their session. People doing their own thing. They're making themselves happy. So, or people making food in the background and a whole lot of noise. And it was not conducive to what, the office setting was like Hadley said. So it was very hard at first, but I've kind of find my niche and made a way. So I time myself, time my clients, what is the best time they will be up and alive and bubbly. Some clients go to their car and talk to me now, because that's the only place they
Because
can
that's
get
the only place quiet. Right.
I remember doing when I eventually got a job and I couldn't go in to see my therapist, she gave me the option of doing it over FaceTime. And at least
FaceTime?
Yeah, at least 4 months after therapy, like on my lunch break, I would close my office door and she would call me and we would talk, just because she told me that it would be very bad if I just say, okay, I get a job now, I'm not depressed anymore, and then just forget about it.
Abruptly terminate. You have to terminate properly.
Right.
That is very, very crucial.
So I did that for even 4 or 5 months after I started working, because I still was going through what I was going through. It just started getting better. But
do you think your therapy helped?
Yeah, she actually did, because I was going, apart from my situation, I think me and my dad had gotten into an argument that I didn't understand, and she helped me with that, and she so it did work. It did work.
Okay, good.
But we're seeing it's almost, well, it's 9 o'clock now, and we don't want you to just come here and tell us what you do. We want you to give your business a plug. If there's a number or an email address that you want to share right now with the people who may need somebody like you, this is your time.
Okay. Well, my website is www.thetherapeuticvillage.com. So THE, the word therapeutic, village.com. And there you can schedule a session with me. You can email me. You can also find me on Psychology Today, www.psychologytoday. And you can just look up Fiona Francis. I'm in Shreveport, Louisiana. I don't know if there's more than one Fiona Francis on there. And also I can be found on Facebook, Fiona Francis. I also have a Village Remedies company where I offer like remedies or stuff that we take into our bodies from back home. Because like I said earlier, I am not against medicine, but especially particularly with kids and stuff, I make sure that they're needed before I give them. So I also offer like more holistic, natural products to people as a form of not medication, but holistic wellness, basically. If you do need medicine, you do need medicine. But if you can thrive and survive without it, I encourage that. So that is also one of my products. So I have many products on there that I offer.
Okay. Well, look, somebody just said we all coming to you.
Okay, great. I'm here.
Y'all making me feel like we have some crazy people looking at us right now.
No,
No, man, no.
No, I'm just joking.
Only somebody
I'm just
talking
joking. Dwayne, you wouldn't want to know who just said that.
I'll find out, don't worry. But but Fiona, you know, we want to thank you for coming on. I think the conversation was very, very enlightening. I think a lot of people enjoyed the conversation. It was
Yeah, I'm happy to
educational.
be here.
Yeah, man. And we will love to have you on again at some point. You know,
Some
if you will,
point.
if you will come back on with us.
Sure.
With that said, we want to thank everybody for watching.
Thank you,
Anybody who
everybody,
has
for tuning in.
Thank you, everybody.
Anybody has any other questions for Miss Fiona Francis? Like she said, she gave her contact information, and we'll also be posting it on our page within the next couple of days. So if you want to get in contact with her, you could get in contact with her. All right.
Yeah, let me just let the people know that it's okay to not be okay. You know, that's my last word. Like when you're feeling down and sad and all types of things that you can't even explain, that's okay. What's not okay is to stay in that rock. So what you need to do is find somebody to talk to. And there are people back home. If the people back home are listening, they can reach out to. I know several other therapists and stuff in the communities and, you know, in town that they can reach out to. And I'm available too. I do pro bono work. I'm not licensed in Dominica, but these are my people and I always want to give back. So if somebody want to talk to me, I'm open.
That's great. One more question from a fan though. It came a little late. If you had to go back and choose a career, would you choose the same thing again?
But you know, I wanted to be a journalist, but I ended up doing the same thing. I think I talk to people all day.
That was maybe your calling, man.
Mm-hmm.
That was maybe your calling.
I think so too.
I think I don't even see myself doing anything else. Honestly, I love what I do. Like I do not see myself doing anything else. And maybe the day that man tell me I had a language barrier was a good thing.
That is, I don't even know what to make of that.
How you speak English? How you speak English in an English-speaking country and have a language barrier, though?
I don't know what to make of that.
Making me feel like I was speaking Japanese.
some other language.
All right, but thank you for coming on. So everybody, we'll be having on next week. We'll be having Jamal Burnett, Mr. Jingle John himself. We'll be having him on next week.
That's my grandpa, you know.
you think my buttercup going to come with him?
I hope so. but definitely, we definitely appreciate you coming on, Fiona, and so everybody tuning in. We will be back next week at 8:00 Eastern Time, 7 p.m. Central Time. We want to thank everybody for joining us. Have a good night, everybody.
Thank you, everybody. Thanks for viewing.